We're going to move on to the next talk. And by the way, there's some good news in that one of the speakers isn't here. So if you're here to learn about billing and coding, he's not here. So we're going to be introducing our own Dr. Josh Roller from Arkansas, who is in private practice. He's the director of the Roller Weight Loss and Advanced Surgery Institute. And he's going to tell us all about keeping your reputation up, marketing, social media, and other effective strategies. So thanks, Dr. Roller.
All right. So I completely agree with everything that was just said in that presentation. That was a great presentation. So those are my disclosures. I can tell you that I knew nothing about marketing 8 years ago. I will tell you that I have learned the hard way. I have spent lots of money doing this. And eventually, when you start spending your own money, you want to start seeing results. And you need to figure out what's going to be effective and not effective. You want to be sure that when you let others spend your money, that they're not wasting it. So you have to have some background, some knowledge of being able to decide, are these people spending my marketing dollars effectively? So you need to be an active participant, and you need to start participating in the marketing process. How many, just show of hands, how many people here are employed by a hospital or something along that? Anybody private practice? So it's about 50-50. So try to gear this towards both groups. There's always been a stigmata in medicine, or has been in the past, about marketing yourself. Somehow that was, you're some sort of scam doctor, or selling witch oils, and Dr. Oz has gotten some pretty negative press here lately. But no one wanted to be associated as looking like a plastic surgeon, because we do more than that. We save lives, we help patients, we're not plastic surgeons. And somehow if you're caught marketing, that must imply that you're not very busy and you have to try to buy your patients. I think in the year 2015, that could not be further from the truth. Bariatrics in general is very different. I think minimally invasive surgery is getting there, and we have the ability to market directly to the patients. In the world of bariatrics, we know that the average patient researches that decision for 3 years, mostly online. 3 years goes into it. You're starting to see now in minimally invasive general surgery, people out there looking for robotic this, robotic that, or single site this, or just laparoscopic. I mean, there's still a huge number of colon surgeries that are being done open in the United States. So by marketing yourself as a minimally invasive surgeon, you'll pick up on those patients. One of the things Dr. Popovich talked about is taking pictures of his incisions, showing it to I show primary care doctors all the time pictures of my colon surgeries. Say, why am I different? Right here. This was a sigmoid colectomy done laparoscopically. You can't see it. That resonates with primary care doctors who don't know really the difference of big open surgery versus minimally invasive. There's also some disagreement out there with when you look at referral patterns. Not all referring physicians, like in the world of bariatrics, agree with weight loss surgery. There's still a persistent population of doctors that thinks surgery for obesity is taking the easy way out. There's a lot of general surgeons, especially the ones who like to do open surgery, that disagree with laparoscopic surgery being better. When I first came out, I joined a general surgery group. And I've quickly found that promoting myself in my minimally invasive skill set was at complete odds with what they were promoting. Why should you come to me? Because I can do your colon through an incision like this. That actually upset the members of my group. That didn't work out very well. Some doctors disagree that diabetes can be cured. Then you've got orthopedic surgeons and spine surgeons, at least in the field of weight loss surgery, who, I had one, actually an orthopedic surgeon say, please don't make everybody skinny. We actually need some knees to operate on. He wasn't laughing. He was 100% serious. So those are some things you have to watch out for, and that's why marketing to the patient actually works. And so who is supposed to do the marketing? Is it you? Is it the hospital? If it's you, some of the pros of doing it are you're in control of your own decisions. You get to decide how your money is being spent. You can determine when you need to act. You've got new competition coming into town. You see another competitor is out there marketing something, you can put an ad out there. You can get together and do something about it when you want. You don't have to wait and go into the bureaucracy of a hospital that seems like it takes them 6 months to make any kind of decision. Or going through the credentials committee, the medical executive committee, and then this committee, then the board, and all this. Do it on your own. You get to benefit from your good decisions. The cons are it's your time and it's your money. The hospital does the marketing. They often, well, they have to market all the surgeons at their hospitals. If you have multiple groups within one hospital, you really don't necessarily want them doing the marketing, because then they're going to lump all of you all together as one. And maybe some aren't doing it this way. Maybe they're still doing hand-assist colons. Maybe they're still doing open colons. But they will market all of the surgeons within that program. They will also want to focus on their program. They're not going to market Josh Roller or Dr. Popovich. They're going to market, come have colorectal surgery at our hospital, or come have bariatrics at our hospital. When really, patients want to know which surgeon is going to be operating on them. And they will focus on how important the hospital is to their outcomes, not so much the surgeon. And the downside with them doing it is you pay the price for their bad decisions. You really have no say-so in what they put out there. And if it doesn't work out well, they'll associate your name with it forever. But no one cares more about your practice than you do. And I found out early you cannot depend on the hospital to do it for you. It is okay to market. Most successful bariatric surgeons do it, especially in the large markets. We see that all over the place. And we are now seeing it again, like I said, with robotics and minimally invasive. Most important key is hire a marketing group. Just like earlier we said, hire a lawyer. You've got to have a marketing group. How do you pick a marketing group? Well, start talking to the other physicians in the area. Best ones to talk to are plastic surgeons. They've been doing this for years and years and years. They know which marketing groups you can go to. Be sure that this group doesn't represent your competition. Be sure that they have a local presence. There's a bunch of national marketing groups out there, but I'm in Fayetteville, Arkansas. I'm in the northwest corner. I really don't want a group out of LA representing me, because they don't know what the local politics and the market is like in my area. So you do want somebody with some knowledge about your area. Your marketing materials, they need to look professional. I can't stress that enough. And this group will save you time and money. Yes, it's an upfront shot. I remember when I decided I wanted to do a website, and they told me it'd be $10,000. I had chest pain that was radiating to my left arm. I was floored. Did it, best $10,000 I ever spent. It pays for itself. And then I've got my brochure experiment. And this is, it's not up there, but I will just tell you, decided I needed a brochure. I spent the better part of every night for 2 straight weeks making one on Microsoft Word. I was making Microsoft Word do things I had never seen it do before. I was so proud of this. And I remember sending my wife to FedEx, go print this out. We need the triplicate folding. We need to do this stuff. Came back, all folded in correctly. Okay, go back. We got to have some more. We got to do it right. So finally decided I was going to meet with a marketing group. And like, well, do you have a brochure? Yeah, I've got a brochure. I mean, what surgeon doesn't have a brochure? I handed it to them, and they looked at me, and they said, who made that? Well, I did. Okay, you need to stop making brochures. In 24 hours, they produced a brochure for me, and I wish it was, oh, here it is. Okay, that's mine. I mean, I thought it looked pretty darn good. And that's theirs. And when I go back and calculate how many hours I spent trying to make mine versus the $500 it cost me to have them make one, it was a no-brainer. It was a no-brainer. So have them make professional materials. You need to establish a brand. You need to get a logo, do your website development, and internet is huge. They've got to be able to find you on the internet. Now there's websites that need, with mobile websites and all the different things that go on it. That's all real important. Business cards, appointment cards, There's billboards that you can go through. There's newspaper ads. Northwest Arkansas, people still read the Sunday paper. We know that. Sunday ads, though, cost a boatload of money. You got to weigh that out and see. Internet search optimization is really, really important. Yahoo and Google AdWords, the things that come up at the top when you search something, you need to get into the top of the list organically and by paid ads. That's how people get to the top. When people call your office and you put them on hold, that's a perfect opportunity for them to hear about what a great surgeon or practice that you're part of. It's a captive audience. Also, they're sitting in a waiting room or sitting in your exam room waiting for you to come in. We have digital picture frames that show before and after on our bariatric patients. We have, our post-op general surgery pictures comparing open to laparoscopic. We market ourselves because maybe the patient already knows that. They're there seeing me for a colon anyway. But that patient's brother and sister and teenage kids don't know that. So you generate more leads just by having them in your office. Or if they're sitting in your waiting room, yeah, it's great for them to watch CNN or Fox News or whatever you have on. But it's better if they watch, I call it I don't know what I call it, but it's kind of an informational DVD I put together where it's just like when you go to the movies and you watch the previews. Spend some money and put together something that's cool like that so it keeps their attention. But develop a plan, and you should depend on this marketing group to develop the best forum for which you want to market. Most people would say about 10% of your collections is a good rough number for marketing. Now bariatrics is a little bit different, and it kind of depends on your area. If you're the only group in town, then that may be a little bit high. If you're in a place like New York City where there's, 10 surgeons every 20 feet, then you probably want to spend a little bit more than that. There's some bariatric guys in Dallas I know spend well over $1 million a year for their marketing. Hold quarterly meetings. You need to get the data back from your marketing group, and they should be able to collect this data for you. What zip codes are they coming from? If you do patient seminars, how do they hear about it? How are they getting there? We always hand out little questionnaires to the patients when they come to the seminars and leave. It says, how'd you hear about us? Primary care physician, newspaper ad. If primary care physician, which one? So I can call that guy and say, hey, thanks, saw your patient at our seminar, really appreciate that. And then reassess. It usually takes about 3 months to figure out minimum if it's working or not. You need to figure out which avenues work the best, okay, and then analyze them. So a lot of people like radio. Okay, if you're gonna do a radio ad, you need to know who's your target audience. In bariatrics, we run about 75% women. Well, when are those women in the car? Because they have to be in the car to hear the radio, most likely. But what if they have Sirius or XM? Then they're probably not going to listen to the radio ad. So those are things, kind of research you need to do to figure out if it's going to work or not. Those are all the different types. But the ultimate goal with your marketing is, okay, they see your ad. Now what do you want them to do? What is the call to action? You want to call your office, make an appointment, go to your website, and you need to make it easy at that point. And once you get them there, you've got to know what to do with them. So your staff has to be set up and ready to take those phone calls or make appointments. They need, and I'll show you an example here in a second of how frustrating that could be. For instance, in bariatrics, we do our seminars in our office. We have a really big waiting room. It's a waste of space most of the time. But it lets them see our office, that it's nice, it's neat, it's clean, it's professional. It gets them into that environment. So now what? The patient hears the ad, and they call in, and that's when it gets interesting. Now, I did something called, how many people have actually sit there and listened to their receptionist answer the phone? Just sat there with them, not knowing you're there, and just listen to them. It's an important thing to do. But then we took it a step further and called it secret shopping, and we hired a group out of Florida to call in, act like they're patients, and record them. And you talk about chest pain. I was shocked. And so the first time we did it, it was horrendous. I'm paying all this money to get patients to call in and make appointments, and my receptionist is talking like that to them. So we did it again a couple years later, and you only get one chance to make a first impression, and that's it. So I'm going to give you an example of, go ahead and hit the play if you would.
further weight loss and advanced surgery.
Hi, I was calling because I've been told that there are different types of weight loss surgery. How do I know which one's best for me?
You would have to meet with the provider and try to find out which one would suit you best.
Okay. Do you know what the costs are on that?
The lap band is $12,500. The sleeve is $14,500, and the bypass is $16,500. Okay.
Thank you.
You're welcome.
I mean, it's embarrassing. It's embarrassing that I pay that money to get that patient to call in to get surgery at my practice, and my receptionist doesn't ask for a name, get their phone number. She was not interested. She acted like that patient was bothering, well, it wasn't a real patient, but actually like that person was bothering her.
What did you do with that?
So we had a meeting. And there was about 8 different phone calls, and all of them suffered from the same thing. So I couldn't fire them all. And I wanted to. I had one where, and I made him sit through it. Patient was on hold for 8 minutes. I was like, you know, what is this, AT&T here? You're on hold. So I made him sit through the whole thing. And then I made him tell me what they thought they did wrong. And just half of it was them listening to themselves. But then we had our marketing group bring in somebody to start going over, customer satisfaction and different ways to interact on the phone. Because ultimately, your receptionists are generally the lowest paid people in your practice. And they are the most critical. And so we invested some money into getting them trained to be able to speak to a patient appropriately. So it's great to market, but the end result, you're doing it to get more patients in the door. And you have to capitalize on that. So when they make that phone call and take that step, you can get them in and do something about it. Facebook, huge, Google, Yahoo, those are all important. You get lots of different information off of this. It's called search engine optimization. Your marketing group should do that. And we compare quarters. So on the left, you can see that's the first quarter of 2014 compared to quarter 4 of 2013. You see our visits are up, average time on the site, what keywords they're using to search in, so you can buy those keywords on Yahoo, Google. They'll be able to do all of this kind of stuff. How are they getting to you, from a laptop or from a mobile device? In this, they've broken it down on our Facebook page by demographics. You see 85% of our patients on Facebook are women. You can see what ages they are on there, and then what country and where they're coming from. So Fort Smith is about an hour south of us. We saw this trend for a year and a half. We opened a clinic down there, a satellite office, based on, and it's been great, but based on where they're coming from. This is another Facebook thing that shows you basically how our likes have increased during this time, and I can't say enough about Facebook. But this slide is interesting because, okay, what's the best time to put out something on Facebook that tells you, oh, here's our patient of the week, or here's this or that? Well, you can see Sunday through Saturday, it's pretty equal in the days that are on there, but you definitely don't want to do something between 3 a.m. and 8 a.m. The optimum time is, early evening. And they will take advantage of it. We can see which post on there really did well. And what we saw is when we put on a before and after of our patient of the week, those killed it. That's where we really did well. And again, this is from our marketing site, or our actual website. Are these people searching for you with keywords, or are they going directly to your website? This is all on there, but use the web, because not to put your nice pretty face on there, but to show the patients what they can get if they have surgery with you. Again, you can use that for MIS as well, but it's powerful. Pictures are worth 1,000 words. And those are the different medias you can use. We do little motivational things on our Facebook that seem to work pretty well. It's just examples of things you can do. But in one Facebook post, one patient, I think we had 190-something likes and however many comments, but it'll also tell you on the business side of things that reached like 7,000 people. and it cost us nothing. It cost me having a marketing group that knew how to put all this stuff on there and do it professionally. So that is important. It's a way to encourage patients to make good decisions too. And you can see right there, I was 161 likes, 26, that was seen by 2,976 people. So it's a way you can get involved in the community, marketing, say, hey, we're not just about doing surgeries and making money, we're actually involved in our community. Everybody in their areas has their best of the best or whatever, doc of the year or whatever, which we all know you actually have to pay money to be that. It's not actually being selected because you're the best. But another great way to promote, hey, people go out and vote for me. Everybody knows about the Ice Bucket Challenge, so we did that in front of our office. We had 3 doctors doing it, and it went over really well. It shows them we're more than just surgeons, we're actually people. But hire experts, spend your money wisely, track your results, and there's not one right surgery for every patient out there, and there's sure not one right way to market. Thank you.
Josh, that was terrific. Any questions from the audience about marketing? My question for you is, for the people out there that are transitioning into practice that are going to get hired by hospitals, where this maybe wouldn't apply as much, are there ways that someone as an employee can still embrace Facebook and Twitter for themselves, or are there rules against that? Do you know the answer?
There are some hospitals out there that have some pretty strict language that they won't even get onto Facebook at all. One of the hospitals I work at, owned by Community Health Systems, they strictly prohibit marketing on Facebook. They just won't take advantage of that medium. And I'm sure there's a bunch of legal reasons why. But in contract negotiations, I would put in there, how many dollars. A lot of times it's in there, okay, we'll give you that we're bringing in 2 new guys to join us, and they're going to give them $15,000 each to market. Okay, well, I've learned in 8 years, okay, who gets to choose how that money is being spent? We want full control of that $15,000 to spend. Yes, we'll market the new guy you're bringing in, but we want to decide how to do it. If you leave it up to the hospital and they use their canned pictures and all the stuff they already have, because that's all they're going to do. They've already paid some group 10 years ago to do it. They're just going to switch out the hospital name and the doctor and put it in. Welcome, Dr. So-and-so. So I would put in the contracts, if I could, that you want some sort of control and say over what is being put out there.
Yeah. And I would also add to that you have to remember your online reputation will stay there while you are negotiating and moving to a new hospital, right? So in the digital world, you are who you are, even though you're protected for the moment under your hospital's dome. If you leave and go someplace else, that follows you. And so back to what Dr. Popowich was saying, whether you like it or not, there is a whole world out there treating you as if you're a hotel or a restaurant, and they're rating you. And you need to take control of your reputation because no one else is going to do that for you.
Well, that's an excellent point. And your marketing group should also be looking online and finding if there are negative posts out there. We had a bariatric patient that was all pissed off because we denied her. She was too high risk. Wasn't going to happen. So she posted all this stuff on there, and they were able to find it, go to, I think it was a Google review, go to Google, write it up, and have it removed.
Yeah, and you can do that. Dr. Popowich had an experience where someone rated him when he was even a trainee. And that stays with you when you're an attending 10 years later. Someone can find that information, and you're just thinking,
Yep.
I don't even know what this is. So you got to find that. You can come to the mic if you have a question, sure.
Seth Spinells from Columbus, Georgia. So who managed your Facebook and your website?
My marketing
Did the
group.
marketing?
Yeah.
So they do all the...
They do it all. I've got them on a retainer, just like a lawyer, because I don't want to be nickel and dimed every time I call them and say, hey, let's do this. There's somebody doing this. We want to put this out. Okay. So you pay that retainer covers new creative and stuff like that. The other thing they do, which I didn't touch on, is they put it in actual paper. I don't know if you've ever tried to place an ad yourself. My brochure, I also made an ad once. Sure. Okay. I don't have the guts to put that in front of, even though there's not many people here, I would never have put that up there, but I did it. And the newspaper's like, well, it has to be in this format, and this, and this, and this. I'm like, listen, I just want you to put the ad in the paper. Make it however you want. I don't care. So they do all of that, and they'll place all of that and let you spend your time operating. But a good marketing group will take care of all of that.
Yeah, there's a number of them out there. Dr. Popwich, can you, for the audience, teach them if they find a bad rating or a bad review, how do you change that? Can you change that?
You can. It's not easy. I'm sure all of you might have Googled yourself or other physicians and seen those top things that pop up in the Google search for vitals, and you compare health and better doctor and all these things. And there will be ratings about you that hopefully are from patients who you've actually seen before. But a lot of times things are put up initially. And all of this, by the way, is public and searched by, you're put up there just based upon the fact that you have an NPI number. And so a lot of these sites do this because they want to sell a report that's actually public information anyway. But what happens is, especially because at least I did not want myself on these websites. I don't want my patients rating me that way. I'm not hiring a marketing firm to put me up there. So what usually happens with these is that it's people who have bad experiences who are going to put stuff up there. So for any physician, you'll read more negative reviews than good. You can Google your friends and colleagues who you know are excellent physicians, and you will only read negative things about them. So in order to get things removed, each one of these websites has rules and regulations over things in terms of what you can take down. The way that I figured this out individually is if you just Google how to remove yourself from these websites, there's this, somebody put on a slide share, a PowerPoint that tells you for each individual website, this is what you do. For some, you can just email the support, and if you follow the rules of, I forget what they call it, there's a terms of use. There are certain things that patients are not allowed to say. If you prove that it's hearsay or if it's just completely inflammatory, it will be removed, and they do it immediately. I found on one of the websites I had a review of 4 out of 5, and but it doesn't show you any of the reviews. It just says you're a 4 out of 5. So I called them up and I said, I want to know why I'm a 4 out of 5. Oh, well, we pull this information from several other reputable sites, and that's what you are. And I said, okay, show me. Where's the one knocking me down? And they realized that a couple of the sites are only 4-star ratings, and that was the problem, and immediately it goes away and you're a 5-star rating. I mean, but that's what patients are seeing. So there is a little bit of work involved in it, but you can get it to be accurate.
Thanks.